Hi guys, my name is Dr. Michael Longier. I wanted to share a case study with you guys today. This is an example of one of the complex neurological cases we see in our office. It's also an example of a brief case study or a brief version of a case study that we'll share in our courses on chiropractic neurology and neuroscience. This case study is a study on dyslexia or convergence insufficiency. And this is something that we pay a lot of attention to in our office. Dyslexia is a really serious learning disability, but it's often or can be sometimes misdiagnosed as a convergence insufficiency, or they can miss the convergence insufficiency, as you'll see in this case, with something like dyslexia. Now, as a chiropractor, we pay a lot of attention to the spine, and in our office and with the advanced training we've done, we also pay a lot of attention to the eyes because what we've found is that the eyes and the spine are intricately linked since birth. The same muscles that move your eyes, your intrinsic eye muscles, they come from the same embryologic or baby tissue as the muscles that move your spine. So we see that connection early on. I usually have people do this as an example. If you put your fingers at the base of your skull and kind of gently, you don't have to push really hard, but then without moving your head, move your eyes side to side really, really quickly as fast as you can. And what you should feel underneath your fingertips is the muscles actually in at the base of the skull in your spine actually firing depending on which direction you're turning your eyes. And this was done for me early on in my education, and it was kind of an aha moment, especially as we pay attention to the spine and spinal health and how that pertains to potentially learning disabilities or the ability to read, the ability to see, and a lot of those things. The other part of that that I had started to see a lot when I got into practice was people with poor posture also ended up needing glasses more often. So that postural alteration or those changes in spinal tone also result in difficulty reading and difficulty seeing later in life with the need for glasses. But sharing this case with you, this is one that was kind of a lot of fun as we uncovered it. Not fun for him, obviously, when a patient ends up in the office. They're usually there for a reason, and this guy was as well. So, case presentation. He was a 12-year-old male, really happy, outgoing kid, just a really good kid, all in all. Played soccer, enjoyed being physical and physical activity, but he was having some trouble in school, so much to the point that there was a test to go from fifth to sixth grade, and he was not passing the practice versions of this test. So he was being told that if he didn't pass this test, they were going to hold him back. He was having trouble reading. He was really slow with reading. So as a result, you can guess he really didn't like reading. He got motion sick when he was tired, especially when riding in cars. He'd have to reread things quite a bit. He'd get to the end of a line and have to reread it again. And we'll talk about a little bit of what that was. He was flipping words and letters and flipping the meanings of things and saying the wrong thing at the wrong time. And as you know, if you know anything about dyslexia, that's really a classic dyslexia kind of finding, right? And he had blurred vision, double vision, and every once in a while kind of had this feeling of feeling off, right? Now, you'll see the picture here. This was actually doing a little bit of care and treatment with him. I'll explain what you can kind of see in the picture, and then we'll jump back into a little bit of what we were looking for and what we saw. You see the eye patch over the left eye there, and it's because he was actually right-handed, but he was left eye dominant. So he was what you call cross-lateralized. And there's some easy testing. We'll go through it in our modules, but if you look up or you even Google how to find out your eye dominance, there's some really easy ways of determining that. For him, we did the little put the nose in between the small circle in between your hand, and you can tell eye dominance really, really quickly there. But we determined that he was left eye dominant, but he was right-handed. So that cross lateralization was something that we had to work on. And we patched the left eye during certain therapies, which would allow us to then strengthen the right. You'll notice the headband looking thing on him. That was actually a head weight. And the reason we use this is you'll see the little green sphere off to the left under his arm. We had him in a Superman position a lot while we were doing activities with him. And the head weight forced the muscles in his spine to activate even more so. And so when we're activating the spine and activating the eyes together with that little bit of weight, it gave us a little more oomph or a little more bang for our buck, so to speak, in creating more stress on the system, which then creates more changes in the brain. So I wanted to show you guys some videos. We actually have a technology called video nystagmography that allows us to record eye movements. And there's two types of eye movements that we'll talk about here with this case. Saccades or fast eye movements, which you're going to see the video here, are your fast eye movements. This is actually how you read. So what his eyes are doing is he's actually watching a dot disappear and reappear on different parts of the screen. And he's supposed to jump from one target to the next with one clean, swift movement. But as you notice, once you get good at seeing these, is if you're watching this video over and over, you won't see the eyes jump smooth. They actually take kind of two movements and it does what's called a hypometric eye movement to get to the target. And knowing that this is how we read, you're supposed to jump from picture to picture to picture. You can guess by looking at these eye movements that he doesn't have an ability to read very well. The other movement is a pursuit movement or a smooth pursuit is what it's often referred to as. And in this one, the target's not disappearing and reappearing and making him find it. On the bottom, he's actually following something that's smoothly moving across the screen. And you'll see that he doesn't do too bad at this one, but he does get a little bit wavy at certain points, and you see a breakdown in his ability to really pursue smoothly through and on the target in all ranges of motion. So again, these are clues that he's probably having some trouble seeing things. Dyslexia is more of a brain issue. Whereas what we're seeing here with the eye movements is a lack of coordination and an inability to really look at those targets as he's going through space or as he's moving his eyes to those targets. You'll also see here in this part of the video, this is where we actually check convergence. And convergence is the ability to converge on a target as it comes close to you. So it's your ability for your eyes to move inward toward a target. And that's really the first thing that you have to do when you're reading is first the eyes have to look at the same target and then they have to quickly move in succession from picture to picture to picture or from word to word to word. And watch what happens when we get close to him as we come near him in the target. So you see his eyes trying to work, but now you start to see his head shake. And that's another example of the link between the spine and the eyes and how those two things work together. So when you see those cases of kids that are having trouble reading, trouble with learning in school, and they also show that poor posture or that forward slumping, you're probably going to see this in a lot of those kids. So the follow-up with him, to keep it short, after we did work with him, and we really only worked with him for a couple of weeks. And again, we did a lot of things in extension. So he was laying belly on the ball, head weight on, patching that eye. We did a lot of throwing balls at him to keep his eyes moving. We had him doing and actually reading some things on a wall. We had him touching some different targets with his hands to link the body to the eyes to the outside world as well. When we got done with him, he took his test and he actually passed and was allowed to move into the next grade without being held back. He continued to flourish in school. This case was a few years ago now. I actually talked to mom fairly recently, and he was getting ready to go off to college. So he was picking what school he wanted to go to. And he developed a love for reading. After I saw him around, after we got done working with him, he was always had a Harry Potter book in his hand. And he had seen the movies, but he said reading the books was so much more fun because there was so much more depth to it. And now that he was able to read, he actually got a lot more out of those stories. So this is an example of what we can do with certain cases, these really tough cases that nobody really wanted to tackle, like with his, and how we can go through a thought process of using applied clinical neuroscience or functional neurology to really get better, more complete results with your patients.